Live here. It's 7:05 and we are live. 7:05 and I'm live, and it's the first one of 2019, and very excited to be here. I wasn't here last week because I had a really bad. I was in A&E last week because my back was so bad. I had a really bad back. I couldn't walk, so it's terrible. So sorry about that. This is the first one of 2019, and I have just got on this because I've just finished operating. So I am not I'm not 100% there. I've usually got all the questions all written down and everything, but I haven't had a chance. So I'm going to do it on the fly. I'm going to do it on the fly while I'm doing it. So hopefully it doesn't look like I'm doing. There you go. That's the standard thing that I can have put on. Live Facebook Q&A. Please comment and share. Please do that. Please do what's saying there. And every Tuesday night, 7 p.m. So what we've got here is we've got some questions, which I am going to go through presently. And if you have any questions, then I'm hoping audio and everything's okay. It's plugged in. The beard's back. I put my beard on specially for this, so it's very exciting. So I've just changed to another screen. So I'm hoping, I'm hoping you can still see the camera. And it hasn't sort of. Did you still see me when I did that? I hope so. Anyway, because I'm gonna put the questions up. I've normally preempted all this, but 2019, not a good start, is it? Not a good start. Slapdash and sloppy. But here we go. Let's go. Question number 1, please. Question number 1 is this. Unhappy after body contouring. So this question, can I edit it? This question is from someone who's contacted me, who is unhappy, and she has sent photos of what she is unhappy about. Is that an unhappy face? No, that's a wink. She's not my patient, so if you're thinking I'm being a bit glib about it, she is not my patient. She's another patient. She's had surgery somewhere else, and she is unhappy. And the question goes, hi, you have been recommended for advice, re-surgery I have had done. I had an FDL, that's a fleur-de-lis tummy tuck, 21 weeks ago, and have excess skin still. I also have a dimple above my tummy button that prevents full movement. I can only describe a feeling inside as a cat's tongue. I had breast augmentation, uplift and implants 9 weeks ago, and also not happy with this procedure. I had an arm lift and have been left with what can only be described as, anyway, an unsightly looking bit of skin in my arm pit. I would really appreciate it if you would look at my pictures and advise. I have done so. I have looked at the pictures and advised, but I said that I would talk about it here. So there's a few things to talk about here. This is quite a lot of surgery. 21 weeks ago is a fleur-de-lis tummy tuck, and then 9 weeks ago is a breast augmentation uplift, and also an arm lift. I mean, that's a lot. Whoa, that's a massive amount of surgery. Point 1. Point 2, it's not really a point. Well, it is a point, but it's not really I guess it's not that relevant, but it is but the point 2 is that it is all quite recent, 21 weeks. She has shown me photos of the results, and there is some excess skin. So we'll go through the problems. Dimple above my belly button that prevents full movement, and also there was a problem with the skin above the excess skin. The excess skin is in the upper part of the abdomen. I've spoken about this before. It's always a problem with tummy tuck, the skin above the belly button. Now it does get pulled down, but when you have a fleur-de-lis tummy tuck, that usually means you've got an extreme amount of weight loss. It's for people who've had significant weight loss with a significant amount of excess skin. And so a tummy tuck, whatever type of tummy tuck, fleur-de-lis or a standard full tummy tuck or whatever, or a mini tummy tuck, whatever, they all address the skin below the belly button. The skin below the belly button is usually where the real excess is, and the excess from the belly button up is always less than the belly button down. The main problem is this lower abdominal skin and fat, and that is what is addressed with a tummy tuck. So when you do stuff to the tummy, that's where you're really tightening it, and you do it by taking all that skin away and then pulling it down, the skin from above. Oh, Barbara. Oh, you need the note. Do you need the notes? Sorry, I would have bought them. Yeah, it's all done. It's all done. Yeah, thanks. So the lower abdominal skin is what you really focus on. It does help the upper abdominal skin because you're pulling it down to close the abdomen, but it doesn't directly address the upper abdominal skin. So if you have significant excess in the upper and lower abdomen, you may still have excess skin in the upper abdomen after a tummy tuck. And it's like anything in this world, ideally, this is something that you need to really hopefully have been spoken to about prior to having the surgery, because you might have the surgeon saying, hold on a minute, what's going up here? The surgery really addresses the lower abdomen. So if there's loads of excess in the upper abdomen, it will be improved, but it might not be as drum tight as you might want it. The other thing with any tummy tuck is we are trying to make it as tight as we want, because we want to give you a great result and we want to give you a tummy that's as tight as a drum, but you don't want the wounds to not heal up. So there's a balance there. So you always, you want good wound healing. I think this patient had quite nice scars and nice wound healing and everything. So there's a balance there. You've got really nice wound healing, but you're like, I've got excess skin. It is an art, not a science, and we try not to take away too much, because if you take away too much, then oh God, can I do that in a minute? Oh, sorry. If you take away too much, the wounds don't heal up, and that's even worse. So, so the answer is, if you do have excess skin in the upper abdomen, you might need another operation known as a reverse abdominoplasty. The problem comes with all of these things is whether that's a revision or not, because people, if they felt that that was going to have been addressed at the time of surgery, might rightly think that should be a revision, i.e. I shouldn't have to pay for it. And then you might find a surgeon who says, well, it's a different operation because that's the, it's another big operation and you have to pay for it. And, really it's about trying to not educate, but explain to patients pre-op what can be achieved with a tummy tuck, and say to them that you might not get the upper abdominal skin, you might have a bit of laxity there, in which case you might need another operation and you have to pay again if you have that other operation, and then they can decide whether to have the surgery or not. But I must say a reverse tummy tuck is only rarely needed. It's only if you've got loads and loads of excess skin, because the full tummy tuck might not get all of that excess skin tightened. So the dimple above the tummy button. Now, I think this is because it was a fleur-de-lis tummy tuck. A fleur-de-lis tummy tuck gives a reverse T-shaped scar. So the scar goes above the belly button, goes straight up and down and meets the normal tummy tuck incision. So it gives like a reverse T or an anchor, a bit like a mass post, I suppose. So the dimple might be the dimpling of the scarring. I think it's the scarring pulling in. 21 weeks is early days. Get massaging it and what have you, but sometimes scars can dimple in, and it's one of the problems with a fleur-de-lis tummy tuck, but it does give you that scar going up above the belly button, straight up above the belly button, well, and below, sort of. I'm not sure the feeling inside is a cat's tongue. Not sure about that one. Don't know what the cat's tongue feeling is really. Breast uplift and implants 9 weeks. This is the same patient now, and also not happy with this procedure. An arm lift described as a funny thing in the armpit. Now the thing in the armpit, what they're talking about, when you do an arm lift, you make a big scar on here, and sometimes you make a little L, or sometimes you do a T. It's okay. It's okay. You can walk past. You're right. You need me. No. Because and the reason you do that sort of the extension into the armpit is because you're trying to stop having a dog ear. A dog ear is a bump. Whenever you cut skin out, you get a bump, and you try and create that dog ear up into your armpit. And the thing that you're describing, the look of your armpit, is sort of it's a bit sort of puckered in, because I think what they're trying to do, it wasn't me, but I'm imagining the surgeon was trying to do is trying to avoid a dog ear. And so when you're trying to avoid a dog ear, you sometimes get a bit of dimpling. You're right, David, it's all right. And that's what it looks like, but you are trying to avoid dog ears, particularly down around your elbow. So although it might look a bit unsightly in your armpit, you have to sort of lift your armpit up to see it. Again, it's a bit difficult for me to be just sort of explaining away all this stuff, because I need to see a surgeon and they should sort of explain what's going on. But I've got to say, the results of the surgery were, I would say, sort of within normal limits. And I think a lot of the unhappiness might be coming from what you expected it to be like, and what maybe I don't know what the surgeon expected, but I didn't see the pre-op, so you have to look always, whenever you look post-ops, you have to sort of take it in context of the pre-op. But I think these things do happen when you have these sorts of big operations, and there are risks and things might not look right. But again, 21 weeks and 9 weeks post-op, give it time to settle, is my advice. At least sort of minimum, I would say, is 3 months, ideally 12 months, but certainly around sort of 6-7 months time. If things aren't settling, then you could consider something, I don't know, maybe a reverse abdominoplasty or something. But for me, I think it all looked like it healed well, and you hadn't had complications, because that's the problem with these operations. Fleur-de-lis abdominoplasty, breast lift with implants, arm lift, these have got a huge risk of complications, wound breakdowns, infections, and what have you. So I know you're unhappy with the result, which is miserable, because I'm sure it cost an absolute fortune to have all that surgery. But you've healed well, you haven't had complications, and maybe that's not much solace thinking about it. Anyway, but yeah, thanks very much for the question, and I hope that's been helpful. So look at that, we've got some comments live comments here. Ellie, good to see you. Is that the surgery room? This is the surgery room, Ellie. There's normally an operating table there, but it's gone. It's gone. The operating table has gone. Tracy, you've always been an advocate of the beard, and yes, the beard is back. Thank you. New year, new beard. Gemma, nice to see you. Happy New Year. It's first one of the new year. Roxanna Changizi. That is Changizi. You need to make a range of something. I don't know what. Skin care products or something. Changizi. Medispas. Changizi Medispa. Anyway, what are your views on fat freezing? Does it work? That's while I'm going to answer that question, I'm going to line up my next question. I've got a question here. I'm hoping, can you tell me if the camera goes when I do this? Because I'm hoping the camera's still on. So Roxana, what are your views on fat freezing? I really want fat freezing to work, because I have got a state. Oh no, I've done that wrong. I have got a clinic, which is like a building, and well, it is a building. It's not like a building. I've got a building which has got a minor operating room. I've got clinic, outpatient rooms. I've got space basically for a machine. And when you go to all these cosmetic meetings and the conferences, they always have these people who are selling these fat freezing machines, and fat freezing is a huge industry, and the people selling the machines will tell you how much money you can make if you get one of these machines, because you make a lot of money out of it, and how much the industry's worth. And why you'll be a fool not to buy one. But I've been looking at these machines for years now, probably about 3 years. And the problem I've got, and the problem I've got is, this is just my opinion, and speaking to patients, and it might be that I see a biased group of patients because I feel that at best the results are often quite subtle. Now I can understand the attraction of it because people don't want surgery, and I totally understand it. I wouldn't want surgery if I didn't have to have it. So I can understand the attraction of the fat freezing, but the problem is the less invasive the procedure, often the less the result. So the fat freezing is not always freezing. Basically, you have to damage the fat somewhere. It's usually either freezing or heating, broadly speaking, with some kind of energy, cold energy or hot energy. And the results that I have seen, they often show good results, but you find when you go to the meetings, they show the same results, the same person. It's often some guy in America, and you wonder what happens in that 6 months. Maybe if you got a patient who had a sort of a exercise regime and what have you, then that might have helped their fat loss. They try and give you studies and things to say it gives, you know, so much % fat reduction or what have you. The proof of the pudding is in the results, and the jury is still out in my view. But my worry is, and the reason I haven't bought a machine yet, is my worry is the results are subtle. And the machines are expensive. That's the problem. So the treatments are expensive. They want to charge almost what it costs to have a tummy tuck for a sort of full treatment for an abdomen. And you think a tummy tuck, you can guarantee, when you look at before and after photos, you can guarantee there will be a result. You don't have to look at it closely. Like I've just done a case just now. I've just done a breast lift with implants, and there is no question that this patient is going to know they've had a result. You can pretty much guarantee that there will be a result. You can't guarantee they won't have problems. You can't guarantee there won't be complications and they won't be unhappy and all this sort of stuff. But you can guarantee there's going to be a result. There's a predictable result with surgery. If you cut a bit of skin out, you know that bit of skin is gone and that bit of fat has gone forever. And so whilst I can see the attraction of these because the complications are much less and they're much less invasive, you can have it literally lunchtime sort of thing often, I think the results are less, the results are subtle. And the problem for me, and this is what I talked about in one of the videos, I don't know if we put it out yet, it's the balance between the non-invasive, and I can understand how there's a big push for non-invasive because no one wants surgery. You know, if I say, do you want surgery? Do you want me to have an anesthetic and stick a tube in and suck the fat out, or do you want me to put this machine on top of your skin and it just dissolves the fat? You'd be like, oh my God, I'll have the dissolving fat one, please. I understand why everyone wants that, but the results are less than they are with liposuction. And the problem is with, well, not say liposuction, with surgery. So non-surgical, the results are more subtle than they are with surgery. And the problem for me at the moment is the price is too high, I think. I think if the prices were cheaper for these procedures, I think patients would accept more subtle results. But I believe, I might be wrong, I haven't got any practice of non-surgical liposculpturing, fat freezing and things. You're probably better off speaking to someone who's got a big practice of it. Well, I have spoken to people who've got big practices of it who think it's great and it's, you know, and it's good from a business point of view, but I'm worried that I'm going to start getting people having subtle results, paying a lot of money for subtle results, and maybe not being quite so happy. And one of the main things I built the clinic on is having happy patients. We can't always guarantee everything will go well. I can't always guarantee that we won't have a complication or they won't turn out the way that you or we hoped it turned out. But I can guarantee we will do everything we can to make that result as best as it possibly can. So we try and get, you know, the idea is 100% happy patients in the end, because even if the result isn't as good as it could have been, we will do whatever we can to make it as good as it can be, and we will get you to the best place we possibly can. And if I start introducing something that then starts giving average results that we can't really make much better, and you've paid thousands of pounds for an average result, you might start saying, you know what, I'm going to give them a 3-star review and say it cost me £3,000 and it really didn't do much. And then I'm like, oh God, I don't want that in my clinic. So that's what worries me about fat freezing. Personally, next week I'll get a fat freezing machine and I'll be like, hey, come and have some fat freezing. It's great. Remember what I said last week? Scrub that. But no, that's where I am now. I am worried about that discrepancy between the amount of the result and the cost. I think, as I say, if it was cheaper and it gave you just a subtle result and just a little bit of tightening and a little bit of, you know, improvement, and it wasn't, and it was a couple of £100 to have the treatment, I think you might accept that. But if it's many hundreds of pounds to have the treatment, or even thousands of pounds to have the treatment, and if you have to have the treatment repeated at that sort of cost, I think you might be a little bit annoyed about that, and that's something that I would worry about. So that is my view on fat freezing. So what has been going on here in this? When did you move? When did you move from Droitwich? Wow. J. Louise Sawyer. You're a patient of mine, J. Louise Sawyer. I think the J is a Louis. Anyway, when did I move from Droitwich? About maybe, I don't know, 5. Well, I've had the clinic for 5 years. Was I at Droitwich when I started the clinic? Probably 4 or 5 years ago. Basically, what I used to do is I used to work at Droitwich, Priory, which is where I am now, Parkway in Solihull, and West Midlands Hospital, and Harley Street in London. I've also got practicing privileges at the Westbourne Centre and at the Spire Little Aston. So I've got privileges to work in hospitals in, like, how many is that? 5 or 6 hospitals in the area. And the problem when you do that is that it's just difficult going all over the place, basically. I like Droitwich very much. It's quite close to where I live. It's a lovely drive because it's nice and drive into the country. It's a lovely hospital, lovely team there, lovely staff. I love West Midlands as well. It's a really good hospital, lovely, again, great theatre team, great staff, ward staff, really nice ward staff. And again, nice hospital. I think they're all nice hospitals. I've got no problem with any of them. But I just wanted to streamline my practice. So I think if I'm just working at 2 hospitals and I'm actually looking at maybe just going to 1 hospital, I'm actually supporting other surgeons now. So I'm sort of working with the other surgeons. So any new patients coming in, I've got to tell this to people, are not seeing me, they're seeing these other surgeons, and I'm sort of running the place. But what we're looking at is just taking people just to 1 hospital, simply for logistics, not to say that the other hospital's bad. All the hospitals are good and nice and provide very good care, and they've got nice nurses and nice theatre staff. But if you're working at Droitwich and at Parkway and at Priory, and you do a tummy tuck where you see people, you know, for 3 days afterwards, and you have to go to Droitwich to see the tummy tuck patients, and then you've got a clinic at, you know, in Edgbaston, and then you've got to go and do an operating list in Parkway, and then the next morning you've got to go and see your post-op in Solihull and your post-op in Droitwich because they're still there. You know, you're driving around all over the place. So that's why I stopped. So I stopped about 5 years ago, and that's why. That's Roxanna Changizi, I've pronounced your name correctly, thank you. Still on. Oh, good, it's still on. Excellent. Your daily beauty regime made Changizi. The daily, yeah. Yeah, Changizi, the Changizi spa, Changizi. I don't know, just see it on a bottle or something. No, not a bottle, because Changizi will be on a box or a medi spa. Anyway, I don't know, maybe you already are. Maybe, I mean, and Roxanna, you've got Roxanna Changizi, that's her name right there. Sarah Eccles, what's the time in theatre for an extended TT? What do you mean by extended, Sarah? Extended? Do you mean TT with TPT? Tummy tuck, I know that. I know you guys are always trying to catch me out with these funny abbreviations. What do you think of my border, by the way? Not my border, it's a new feature. You do realise that a lot of work goes into this behind the scenes. tummy was extended? Extended what way? Do you mean like a circumferential tummy tuck, so that you go all the way around the back? Is that an extended one? Or fleur-de-lis, where you go up? Or tummy tuck with lipo? So I would, I'll just answer I'll answer a different question. If I've got to look at the chat in case you answer that question. Oh, hold on a minute. Changizi, hold on a minute, what's going on? Oh dear, I don't know if I'm doing this right. I'm going to go further around the abdomen. Right, Sarah, what you've got to think about is that, I'm losing it on the comments. I need an assistant to help me. Oh my God, Jade's put stuff in, oh my God. Anyway, Sarah, go further around the abdomen. Sarah's got something else. Why surgeon won't do liposuction at the same time as a tummy tuck, me being BMI 28, just a bit further around beyond the pelvic bones. Sarah, what you've got to think about is you're lying on the operating table. And so we don't really want to move you too much. So you go round the tummy laterally to the sides as much as you need to. So someone who's just had one pregnancy, you've got a bit of skin, redundant skin, you might not have to make the scar long. If you've got a lot of excess skin, you have to make the scar longer and go round more towards the pelvic bones. I'd still call it a full tummy tuck. Full tummy tuck being one with the scar around the belly button. So I'd still call it a full tummy tuck. I wouldn't necessarily call it an extended, but obviously this person's calling it extended, but you know, they're all full. So sometimes a full tummy tuck is shorter scar than another one, which will have a longer scar because there's more skin. Once you start actually going around the back, and that's a different kettle of fish. That's a belt lipectomy or circumferential tummy tuck, which is a totally different thing. So in answer to your question, so it's obviously in terms of a full tummy tuck, it's a bigger full tummy tuck. I'll talk about the liposuction because that's a good question. But without liposuction, a full tummy tuck, I'm going to go 2.5 to 3 hours. For me, 2.5 out to 3 hours, maybe 2.5 to 3.5 hours. Yeah, 2.5 to 3.5, I'm going to say. For if you're quite big and it's going to be longer, BMI 28, maybe 3 hours. 3 hours is the answer. That's my final answer. 3 hours. Yours, right, we go, oh God, what's going on? Right, so Roxana has said, would you do more liposuction after a tummy tuck? Good question. I think that Roxana also, I've had a tummy tuck with excellent results. Good, Roxana, good to hear. Which you could say you might have patience, but you're not. But anyway, well done that. That's excellent. Tummy tucks do or can give really fantastic excellent result. Sandra Russell has just said fantastic. One word review, fantastic. Don't know what you're referring to, Sandra, but it is good to. Oh, Sandra said, have you? I saw that post come up. Have you had any plastic surgery? That's a good question, isn't it? Sandra, that's a bit personal, isn't it? Do you think this is a result of nature? Do you think that I could have this visage without any external help? Come on. Look at that face. Look at this body. Of course I've had plastic surgery, everything I can get. All works. You should have seen me before. Oh my God. It was a wreck. No, I haven't had any plastic surgery, Sandra. It's a bit funny when people say, would you let your daughter have plastic surgery? Sometimes people say that. Would you let terrible plastic surgery? All plastic surgery is all bad, isn't it? It's all, would you let your daughter have plastic surgery? For me, I'm like, it depends on whether they need it. So I don't think people should feel bad if they've had plastic surgery. It's like, have you had orthopedic surgery? Have you had ENT surgery? Would you feel bad about that? It depends on whether you need it. No one has surgery if they don't need it. Everyone's all plastic surgery, you don't need to have plastic surgery. Well, you don't need to have a lot of ENT surgery and a lot of orthopedic surgery. It just makes your life a bit easier if you do have it. And it makes you a bit, feel a bit better. So that's what most surgery is trying to do, making people feel better. And plastic surgery can do that, just like ENT surgery can do it, just like orthopedic surgery can do it, and whatever. So what I would say, if I needed plastic surgery for whatever reason, so if I needed to have something done, I would have it done, whether it be plastic surgery or orthopedic surgery or ENT surgery or general surgery. If I thought, well, I had a hernia, so I had general surgery. There you go, because I had a hernia. But I wouldn't have had general surgery if I didn't have a hernia, would I? I only had it because I had a hernia. Same with plastic surgery. Don't need anything. But if I did, then I would, if I did need something, then I would weigh up pros and cons. I'd weigh up the risks of surgery against the benefits I was going to get from the surgery and make a judgment on that, whatever type of surgery it was. But no, I haven't had specifically any plastic surgery. Would you do, so here we go. I'm also, I like that question. Here we go. Sarah's saying, my surgeon won't do liposuction at the same time as a tummy tuck for me, being BMI 28. That's a bit harsh, Sarah. Surgeons often, me included, won't do liposuction to the upper abdomen. I'm going to do a bit of, you can see this is all way. So you're going to see my things all. Anyway, to this bit here. I should have untangled that. It's all a bit, because you're worried about the vascularity of the skin when you do a tummy tuck. So you worry about interrupting that vascularity. So you don't do surgery, liposuction to the upper abdomen when you do a tummy tuck. Is this what Roxanna's saying? Would you do more liposuction after a tummy tuck? Think about that lady who had the fleur-de-lis, had a bit of excess fullness in the upper abdomen. Sometimes a bit of liposuction to that can help, but you do it later. You wouldn't do it at the time of the, well, I wouldn't do it at the time of the tummy tuck. Many So, God, Sarah, you understand? God. Yeah. So, is it the upper abdomen they're talking about? So, I think that's standard. Where you usually do tummy, where you usually do. I know I disappeared. I don't know what happened, but it was pretty frightening. I can tell you. Is here? You do tummy, you liposuction here when you do a tummy tuck to the sides, the flanks, the hips. That is standard for a tummy tuck. I don't know, so your surgeon might be saying they wouldn't do it to the upper abdomen, and that would be to anyone. It might be because you've got a BMI 28, they might be saying you've got a bit, so this might be your surgeon saying you've got a bit of fullness in your upper abdomen. I'm not going to do any liposuction at the time of the tummy tuck, but I could do it later. But then you'd have to, then maybe you're prepared, particularly if you have to pay for that liposuction later, you're prepared for that, because you have to prepare people for the result that they can achieve. You say, I'm going to do a really good result with your lower abdomen, but I can't really. So that might be where your surgeon's going. I can't really get too much in the upper abdomen. You could always have some liposuction later. And you're probably saying, well, why don't you do it at the same time? And he's saying no. And that's probably why he's saying no, because he is worried about the vascularity of the skin, because the wound healing is essential. Because whilst you want the best result you can possibly get, you want a drum, tight stomach and everything, we're thinking, please, I don't want to have any complications. I don't want to have, obviously we want you to have a good result, but we don't have any wound healing problems. We don't have any, wound breakdown things. So we don't make it too tight, and we don't want to interrupt the vascularity too much with our liposuction. But at the same time, we want to give you a brilliant result. We've got to balance that. And you're probably focused on having a brilliant result, quite rightly. But, any surgeon is always in the back of their mind thinking about risks and things. Jade, just had a breast augmentation with Mr. Kuram Khan, only 1 week post-op, and I'm already so happy. I highly recommend him. He instantly made me feel comfortable and put my full trust in him, and my outcome is everything I wanted. I saw Vicky at the standing clinic today, and she's just fab. I mean, you know what, Jade? People will think that's, well, obviously it's not me typing that, but they'll think that's Kuram. Is that Kuram typing that? I mean, look at that. That's the sort of publicity we need. Thank you, Jade. That's fantastic to hear. Kuram is an excellent guy. Kuram is pretty much doing most of, we've got Kuram and Azam, Kuram Khan and Azam Faroa. Azam is doing the skin, because that's what he does. He's a skin guy. He's a plastic surgeon, but he does all the skin. And he is, and Kuram is pretty much seeing all the GA cases, the breast and tummy, what have you, for me. So a lot of people are ringing up and saying, oh, I want to see the guy that I saw on the video. And they're saying, well, that's me, by the way. And the staff saying, you know, he's not seeing any new patients. You got to see Kuram, and they say, well, who's Kuram? I don't want to see him. But I work with Kuram. We were supposed to be doing a case just now, to be honest with you, but we work together. I am running I can't do all the work, do all the operating, and still build the clinic. So my focus is on building the clinic, working with the other surgeons, working with Kuram and Azam, getting the processes in place so that we can do an excellent, a world-class service. I genuinely want to be able to give a world-class service, and I think that is achievable because I know what the benchmark is for service, and I genuinely think that we can do that and do that. So, but it takes a lot of work, and it takes, you know, we need to get all the staff and everyone on board, and that's what I'm all about. So, so that's good to hear. And Jade is so happy she's put it twice. So that's awesome, Jade. Thank you for that. Very kind of you to write that. Roxanna, thank you for getting involved, Roxanna, and a great question by the faculty. Jay was Harding. That's it. So I had my breast enlargement with you in Droitwich. Yeah, well, come to see me at the clinic, you know. I think I still got some privileges at Droitwich, but I don't really do any surgery. I always, so having said that okay, I'm losing the thread here. If I was come back for more work done, would it be work you again? Work you again? Yes, it would. What I've said is that I'm not seeing any new patients, but I am seeing my current patients. And as I hope you know, you're not Jay, are you? You're Louise. But anyway, are you Jay? Anyway, what I hope you know is that I never discharge anyone. So I will see you anytime, whatever, whether it be for the problem that the surgery you had in the first place for a checkup, or if you want something else, you know, that's fine. Come and see my current patients. I will continue to look after my current patients. I won't say to my current patients, oh, you've got to go and see Kuram. I am still doing clinics, and I will see you at my clinic in Edgbaston, no problem at all. It's just for easily needed surgery, I would probably say, look, come to one of the theatres up here. If you said, look, I desperately want to have it done at Droitwich, well, I'll probably say it'd be better to have it done up here. But yeah, yes, Jamie, yes. Right, now we're talking. Now we're talking. Jamie Harding, now you know, why don't you say? I remember you. God, that's going back a bit. Yes, by all means, whether or not you want anything done, just come to the clinic and we'll see you. Drop us an email, get on Facebook, where you are on Facebook. On Facebook, you know, do a message or something, or just give us a ring. Give us a ring. Do you know the number? I'll put the number up, and I'll come and see you. No cost or anything like that. Here we go. On screen update. 0121. This is what we need. Phone number 3680. There you go. Give us a ring, 0121 454 3680 tomorrow, Jamie, and make an appointment Wednesday and Friday in my clinics, and I will see you, and we can see how you're getting on. Lovely to see you, see how you are. If you've got any issues, if you've got any problems, or if you want anything different done or anything new, I'll be happy to see you. Yep, still seeing my current patients. So that'd be lovely to see you, and good to see you here. Blast from the past. So where am I at with the question thing here? Go further around the abdomen. You've done that. Just a bit further around the pelvis bones. Done that. I've been told extended TT too. Oh, here we go. Everyone's been told extended TT. All right then. So is that a thing then? Extended TT. Okay. I would just still call it a full tummy tuck. The main thing for me is whether I'm going to change the positioning of you, and some are longer than others. Anyway. Fine. Terminology he doesn't know. Not at all. You're so handsome. Very kind of you, Sandra. Nice to hear. Sarah now understands. Excellent. I've disappeared. I know that was a while ago. I'm coming back. I'm just catching up with the thing. That's great. Getting down to 25 BMI now before I go ahead. Yeah, get your weight right and stable before you have surgery. If you can get it down to 25, that'd be perfect. And the other thing is you've got to try and get it to a sustainable weight. You don't want to get it down to 25 just sort of falsely sort of thing for the surgery, and then you're not comfortable at that weight, and then you put weight on afterwards, because that would not be a good thing. But if you can, ideally, if you can get your weight down, your risk of complications, what have you, are less. So that's certainly a good thing. Is it safe to have liposuction on upper part of abdomen before tummy tuck, or would it compromise blood flow? No, you can have it before tummy tuck. Yeah, that is safe. You probably want to leave it a few months, 3 to 6 months before having the tummy tuck, but you could have it done that way around if you wanted. But I would say have the tummy tuck first, because I say it does pull down the skin of the upper abdomen when you have a tummy tuck. So you might find that actually when you have a tummy tuck, that would be improved. So you might have actually sort of wasted your money if you have the liposuction first, but you could do it. It would be fine. Jamie, thank you, perfect. I'll be back in touch. Yes, please do be back in touch. It'll be good to see you. Sad to hear you're not taking on any new patients. Don't be sad, Roxana. It's because if you are trying to, if you're trying to do something good and provide a really good service, what happens as you get busier? This is something I was aware of when I started. There's a tendency to potentially give a worse service when you get busier. So, and that's something I was very, and that, I sometimes see that. I see people who are very busy, and I think you actually can't give quite as good a service as you were giving when you were less busy. So you don't want to get busier and give a worse service, because my thing has always been about giving a good service. And so I try to sort of do a bit less, but really it came to it that I think I just really want to focus on the clinic and the service and how we treat people and how the clinic is run and how it is perceived by people, and getting good surgeons. It's taken me years to find, we're looking for surgeons over the last 5 or 6 years. I'm very happy with Kuram and Azam, getting good surgeons who can provide the surgery to the same standard that I provide the surgery. There's trained to the same level, the expertise to the same level. We can work together in theatre, but that's something that can then still provide the same service. So we can get more surgeons in as we get busier. In fact, we already really need more surgeons to get more surgeons in to still maintain the service. I don't know if that makes sense, but that's what I was finding. As you're getting busier, your service gets worse if you're the only person doing the surgery. Because if I'm doing the surgery all day, every day, it's hard for me to keep track on what sort of service we're giving to our patients and what's happening in front of house and what's happening with inquiries and all this sort of stuff. So that's where I am. I hope I verbalized that, but that's where I am. But I'm still, I'm in theatre. Look at me in theatre today. I'm still in theatre. I'm still here. I'm still living it. I'm still doing it. I'm still on the, I'm not going to stop being in theatre. It's just I'm going to be sort of helping the guys. So it's all sort of in my name. Sharon's sad too. Everyone's sad. Don't be sad. Don't be sad. If you want to, there's a limit to what you can do with your own 2 hands. I've always been, I've got a family. I've got 3 children. I don't want to be operating all day, every day. I see people who sort of start operating in the morning, finishing operating, start at 8 in the morning, finish 10 at night. Oh, I know it's 8 o'clock at night now, but not an example he says as he's sitting in theatre at 10 to 8 at night. But anyway, but you don't want to be doing that all the time. It depends on what your goal is. If your goal is just to do surgery all the time, and I think some surgeons, that is their goal. They love doing surgery and they just want to be in theatre all the time. That's fine. But that's never been my goal. I don't want to be doing surgery all the time. I want to make sure the patients, I'm providing good care for patients. That patient who asked me earlier, all that stuff about the bulge in her tummy tuck and armpits a bit puckered in and all that, she had surgery by a surgeon. And I'm like, well, why didn't you ask that? Why is that surgeon not telling you all the things I've just told you? Well, possibly, I don't know who the surgeon was, but possibly that surgeon was a surgeon who liked doing surgery all the time, and he's neglecting to look after his patients because he's not talking to them about it, and he's not talking to them about what's going on and what you can expect, and and when they do get a result, what that result is and how that result's going to change and all that sort of stuff. And I think that's a problem. I think you have to look at everything. You can't just, well, some people do just focus on the surgery. I think you have got to focus on everything else. So that's where I am. I'm trying to focus on the other stuff. There you go. Look, you got me started there. What's going on here? Would you recommend other surgeons, perhaps those who work in different parts of the UK? Yeah, of course, Roxana. I know people all over the place. And a bit like when people say, should you go abroad for surgery? I'm like, no, you shouldn't go abroad for surgery. You should have it done close to home because of all the problems. If people live in Essex, for instance, I had an inquiry a while back from Essex. I'm like, look, I used to work in Essex. I know loads of really good people in Essex. You know, don't come all the way to Birmingham, because if you have a problem, or even if you don't have a problem, you have to drive all the way to Birmingham, and then I want to see you for follow-up all the time. You have to come all the way to there's loads of really good surgeons in Essex. So, or wherever, or in Manchester, or in Leeds, or in Glasgow, or in Dublin. That's people from Dublin, or Edinburgh. That people, you know, but people from all over. Cornwall, you know, there's really good surgeons. Well, not in Cornwall, but in Devon, Bristol. You know, so yeah, definitely. I know people all over the place. So it's good to have it closer to home. I would stand by that. I stand by that because I say to people, don't go abroad for surgery. So I can't then say, oh yeah, come to have surgery with me if you live in Edinburgh or something like that. I mean, people do, but I would say to them, you're better off, to be honest with you, getting someone local, because then, you know, you're close by. Any problems, nip into the clinic, see how you're getting on. And we can do things by Skype and by all that sort of stuff, but it's always good to get things done locally. Sonia, he has already said not to have liposuction to upper stomach at the same time as it. Look at that, we've got interpersonal chat here. Sue's having a go at Sonia. Awesome. Sonia, sorry, I meant oh God, what was this going on? When did this go on? When did all this happen? Where was I? Sonia, sorry, I meant liposuction at the same time as tummy tuck. And how long would I expect tummy tuck to swell post-op? Yeah, so yeah, liposuction at the same time, not at the upper, yes, at the sides. It's always that. How long to swell post-op? Sonia, I say things start to settle. Again, go to your surgeon. I don't think I'm a surgeon. Go to your surgeon, but I think things start to settle at 3 months. It's not a quick one, you know. The first, you know, few weeks, things are pretty swollen. It's a bit up and down. Swelling goes up and down in the first few weeks. It's, you know, starts to settle 3 months, 6, 12, even 18 months, things are really properly settled. 12 months, I think things are really starting to settle. But, you know, 3 to 6 months, really, I think it's a long time. It's not a quick one. Yeah, you don't want to work yourself to death. Sue, you don't want to work yourself to death. But the other thing you've got to do is you've got to do, you know, what you enjoy. And I really enjoy making sure the service is right and making sure that we are giving good information to people and, you know, this sort of stuff. And, you know, I enjoy doing that sort of stuff. So I'm doing what I enjoy. Maybe these people just enjoy being in theatre from 8 in the morning till 10 at night, and that's fine. And they should do that, and they should be happy doing that. The worst thing is when you do that and you're not happy doing that, you know. I like being in theatre. I love it. I love being in theatre. But it's nice, you know, I'm going to be in theatre with the other guys. Are there any foods to avoid in the run-up to surgery? No, not really. I think people say all sorts of stuff, but no, not really. Sheffield. Are you on a good surgery in Sheffield? Now, first thing is, depends what you want, Sarah. Do I know what you want? Sorry, Sarah, have you been asking about the tummy tuck thing? Let me think. Sheffield's a difficult one. Hassan Shaban. Is he Sheffield or is he Liverpool? I think he used to be in Sheffield. Hassan Shaban. Lovely guy. Hassan Shaban. Plastic surgeon. I think he's up there, Sheffield way, I think. Bristol, Roxana, easy one. My buddy Anthony McQuillan, saw him yesterday. Has that worked? Oh, I pressed hide to show. Oh, I've done it wrong. Oh, done it wrong. I pressed the wrong button. So Bristol is Anthony McQuillan. Yeah, that's Bristol. Got any others? You know what you do? You can look at the BARP's website, BAAPS, and BAPRAS. BARPS and BAPRAS. They're the two sort of plastic surgery associations, and they've got websites through BAAPS and BAPRAS. These are the websites for plastic surgeons, and you look at the website and it tells you all the list of fully trained plastic surgeons, and it tells you what their specialty is. So BAAPS, British Association of Aesthetic Plastic Surgeons, does it by region. So if you live in Sheffield, you'll see all the ones up there. And BAPRAS is BAPRAS is the plastic. I'm not sure if it does it by region. I'm not sure by name. Sharon, it's like a minefield trying to find the right surgeon. Yes, it is. Yes. I think BARPS and BAPRAS is a good place to start. I think, yeah, well, that's why I've written a book. Where's my book? I need my book. Never accept a lift from strangers. I've written a book on it. It's such a nightmare. Most of them aren't trained, to be honest with you. There's all sorts out there. It's an absolute minefield, and I don't know what to say. Well, I do. Go to my website, and I've got all this guide of what to ask a surgeon and the book on it. But basically, the bottom line is meet them face to face, see if they've got good results, look at reviews and things, talk to people, previous patients. We always say, look, do you want to speak to a previous patient? Now, you might say that's biased because we're going to put you in touch with that patient. So, but it is a minefield. Do you know anyone? If you know a friend or anyone who's had surgery and they've been treated well, I would say that's the first thing. If you know a friend who's had surgery and they can recommend it, I think personal recommendation you can't beat. But I know a lot of people may not know anyone, but it is a minefield. It is a minefield. And the problem is the legislation isn't very tight on it. So there's all sorts of people doing it who aren't trained, and there's no sort of law against it. Sue is back in. Why do people get a swollen tummy after a tummy tuck? Their tummy is constantly swollen. It might just be swollen of an evening. Does it happen forever? No. There's two things with the swelling, Sue, after a tummy tuck. One is swelling of the tissues in terms of if you bang your arm, you get swollen, and that's called edema. That is a swollen tissues. When you operate on anything, any part of the body, and when you traumatize any part of the body, and let's face it, surgery is trauma, you get swelling, you get edema. The other sort of swelling you can get with a tummy tuck, more specific to a tummy tuck and other sort of operations, is a seroma, you might have heard of. And a seroma is actually fluid, watery fluid, which collects in the space that has been created when you do a tummy tuck. Because when you do a tummy tuck, you cut out a big bit of skin, but then you have to make a tunnel up to the rib cage in order to pull the skin down, to pull it down tight to get the wound closed. That's why we don't do the liposuction, because we're pulling that skin really tight and we're sort of pulling on that skin. And because you made a tunnel up to the rib cage, there's a space, and that space can fill with water. Well, it's not water, it's serous fluid, wound fluid, and that can slosh about. So that can cause swelling as well. The serous fluid you can take out with a needle. And sometimes you can get a persistent seroma, you can get a loculated seroma. The seroma can get encased in scar tissue and doesn't go, and you might have surgery to remove it. So that's something that you could have a permanent problem with swelling after a tummy tuck, although you could do things to try and fix it, but that can be a problem. It's pretty rare. I have seen it, I've never had it. I've seen it in patients with it, but personally I've never had it, so it's a pretty rare thing, but it's definitely out there. But usually it's just swollen because it's so traumatic, and it's just edema. It's usually edema, just tissue swelling, because it's a big op. If you saw it, you'd realize it's a massive op, and it takes ages for the swelling to go down. And maybe a little bit of seroma, and this seroma usually settles on its own. But if there's a lot of seroma, a lot of stuff sloshing about, then you can put a needle in and drain it off. But your surgeon should be able to tell the difference and sort of examine you and see what's. Sue, 3 minutes ago, God knows what I think I'm way behind on the comments here. I don't know what's going on. Sonia says, thank you. Blackburn, willing to travel, though, as I'm not keen on going abroad. Oh, God, this is tricky. I'm getting Blackburn. I don't know. I don't know, Sharon. Go to the BART's website, Blackburn. The problem is that there's only plastic surgery units in big cities, and so there aren't plastic surgeons all over the country. That's the other problem. So the reason why a lot of sort of non-plastic surgeons pop up because I don't know, they're probably find there's a massive unit in Blackburn now, but sorry, Sharon, I don't know Blackburn, but have a look at the look at Barb's website. He did my tummy tuck. He is fantastic. Can't fault his work, says Roxanna. Who Roxanna? I'm in Britain. Oh, Anthony McQuillan did your tummy tuck. Did you? Or excellent, Roxanna. Good to hear. So there you go. I recommended the guy that you saw. Brighton. Oh my lord, this is what have I done? What have I done? I shouldn't have started this, should I? Okay, Brighton. Now I don't think there's any plastic surgery units in Brighton, so I think most of them will go sort of. There's one in East Grinstead. There's Mark Pacifico in East Grinstead. He's got Purity Bridge. Obviously, there's lots in London. There's Paul Harris. Should I write these down? There's Paul Harris in London, who's a lovely guy, excellent surgeon. And I think he works in Surrey. So Mark Pacifico is in Tunbridge Wells, and Paul Harris is in London. And I don't know if they go to. I don't know if they go to Brighton. But that's sort of, London's not too far, is it? So Mark Pacifico, they're good. Says, right, blimey, I've got into something. This could be should we do a Facebook Live specifically for people asking me areas of the country with good plastic surgeons in? But you can see there's good plastic surgeons all over the country, loads of us. We're all over the place. Penny a penny, you trip over us. But look to the BARS website, because there's also all sorts of others undesirables. No, I'm sure they're not. I'm sure everyone's trying to do the right thing. Or his methods, man, I would also recommend him. Roxanna, I think you're talking about Anthony McQuillan. I don't know. Yeah, oh yes, is that answer? You see, I'm way behind on the, I think you are. Is that where dry brushing can come into effect? Oh my God, what the heck? What's dry brushing? Dry brushing? Sorry, Sue, do little sparks. I don't know what dry brushing is. When you are swollen. Dry brushing, what's dry brushing? I live across from a BMI who has a plastic surgeon, but he's so expensive. Yeah, well, what can I say, Sharon? After 2 years of research, there's a massive difference in prices. You know what, Sharon? I don't know what to say. Go and meet him. You know what? It's difficult, because what I always would say is that it's not so much about price. Obviously, it is about price, but it's about value. And what this is goes back to the fat freezing. If you're getting value for money, you don't. Well, first of all, if you can't afford it, you can't afford it. You know, that's fine. But no one can afford to spend money on stuff that isn't worth it. No one would spend money on something that they could get for less money. Doesn't matter how much money you got. You're not going to spend money on something if you can get the same thing for cheaper. So it's about value. And if you're getting more value, then you'll happily spend more money. But if you're not getting more value, you won't spend more money. So I think we as plastic surgeons need to, if we are going to be more expensive, we need to give more value. And that comes in training, expertise, in the results we give, and how we look after people, aftercare, and all these things. And maybe he's maxing out on that, and but it's hard before you've seen him. He needs to convey that before you've seen him. You can't just say, I charge £1 million, take it or leave it. You've got to say, I charge £1 million because I do this, this, and this. And look at all these patients that I've got that are so happy with my work. I've never put a foot wrong, and if I do put a foot wrong, I always make sure it's all done right. Yeah, but it is tricky. But I wouldn't go just on price. I wouldn't base it just on price, because you can always find a cheaper one. But you want to get value for money. You don't want to spend a lot of money on something and then get a rubbish result and then not get looked after, and you think, flipping it, that was a waste of money. So that's why this whole thing's hard, isn't it? I haven't given you an answer there. But do you want to tell me? Maybe not. There it is. But if he works I'll tell you what, Sharon. If he works at BMI Hospital, he will be a BARPS member. Because if you work at a BMI Hospital, you have to be. Well, he might not be a BARPS member, but be a fully trained plastic surgeon with FRCS Plast. If you go to a BMI or Aspire or Nuffield, one of those big hospital companies, then you will get a fully trained plastic surgeon, because they won't allow you to work there unless you are a fully trained plastic surgeon. So he will be a fully trained plastic surgeon. Is it going to be worth it? I don't know. Tricky one, that, Sharon. Massage. Oh, is that the same as dry drainage? Massage to assist the drainage. Yeah, you can do a bit of massage if you want. What drainage? The edema. The main thing is the garment, Sue. I think, well, as I say, I need a PA, because I think this is talking about edema after an abdominoplasty, is it? I think that's what we're talking about. So yeah, a garment is often good. So pressure is good, a garment. Massage, if you feel that it helps, then yes, you can do that. And if your surgeon has told you to do that, then do that, because I know that some surgeons talk about it, and there's things like lymphatic massage and things like manual lymphatic drainage and what have you, which can help with swelling. For me, I think the garments can be good, or big pants if the garment's uncomfortable. And time will help with it. If it's edema, if it's seroma, then you can have it drained if it's a big one. Yes, Sarah, God knows what that's referring to, because I don't know where I am on the chats. Love your live chats. Thanks, Roxanna. Nice to have a bit of support there. Hope I'm not getting too mixed up here. Yes, to dry brushing towards the heart, but avoid any stitching, you said, or bruised area. Dry brushing towards the heart. Okay, yeah, go for it. Dry brushing, oh, here we go. Sue's in. Sue knows what she's on about. Dry brushing and lymphatic drainage massage can help with swollen stomachs. Exclamation mark. I don't know if that means it can't because of the exclamation mark, or it can. Yeah. But yes, I think, sorry, I don't know what dry brushing is, but yes, massage can help with swelling. And certainly if you feel that it helps, that's the other thing. If you feel that it's soothing or what have you, then fine. But often it's often it's time and support garments. I'm getting a bit out of my depth here. Is it common to operate on Ehlers-Danlos patients? No, Sharon, it is not, because Ehlers-Danlos is a condition with, well, you probably know, it's skin elasticity, and it is associated with poor wound healing. So it is a risk that you have a risk of having an unfavorable result. So it's certainly not, it's not a common condition. And it's therefore not common to operate on people. It's a bit like what I said earlier about would you have plastic surgery. It depends what the problem is, that whether you have plastic surgery or not, but you will be at a greater risk because your skin is much more elastic than other people. It is hard to make it tight. And a lot of surgery that we're doing is trying to make things tight, or like tummy tucks and mastopexy and things. It's sort of really got a lot of give in it. It's hard to make it tight. That makes sense. And so you can have problems with wound breakdown. What's that, Sharon? So Ehlers-Danlos, here we go. Lax muscle tone, veins, etc. I suffer from, but there's lots of symptoms. Yeah, collagen deficiency. Yeah, okay. So you suffer from it, Sharon. Yeah, so it is a risk, unfortunately, if you're going to consider having some kind of body contouring procedure. You have to be aware that is going to increase your risk of having a potential complication and maybe not having quite as good a result. So I'm up to date with the comments. I think if the camera stays on, we'll be away. So here we go. Here's a question here. I did have him. This is a question of a patient who I've operated on doing something else, and she's said, she's previously had implants which have been taken out, and now she's asking if she can have implants again. And I said, well, you've already had implants, but you had taken out, not by me, way back. And then she said, I did have implants many years ago. I requested small and natural, but I woke to find huge and very unnatural looking breasts. I have been happy without implants until recently. I think age is a major factor in my change of heart. So this patient's now thinking of having implants put back in again. Now, what I wanted to talk about here was the fact that she thought she was getting a natural result and she woke to find huge unnatural implants. And I think that is a worry of a lot of people. A lot of people think that they're going to wake to have unnatural, huge implants, and it's going to look ridiculous. And I totally understand that. And to be honest, I worry about it too, because it's all about managing patients' expectations and making them what your expectation was match with their expectation. And it is really hard. And I haven't got the answers. What I would say is, the reason I wanted to talk about this, I know this isn't really a question, she's just making a comment on it, but what I wanted to say is that it's something that we do worry about. And that's why I say come back to the clinic as often as possible, and we just try and give you an idea of what it's going to look like. We cannot tell you what it's going to look like. It's always a bit of a leap of faith. We have sizes, we show before and after photos of other people. Based on your dimensions, we'll already limit the amount of implants that you can have. The range of implants you can have will be limited by your anatomy, whatever. You can't have any implant you want. There is 3D software, we've been looking at that too, a bit like the fat freezing, where you can take a photo and then morph it. So you can say, take a photo of you now and then say, this is what you'll look like with 300cc implants in, and this is what you look like with 200cc implants in. And I think that can be useful. There's always that worry that, if you don't look like that sort of thing, that's always a bit of a worry. But I think we don't have the 3D morphing software. It's another thing that we have looked into, and there's just a few issues around it that, that if when you're doing things like rhinoplasty and what have you, it's hard to guarantee you're going to deliver that result. So whether it's helpful to the patient or not, you don't want them to think that they're going to look like that, but then if they don't look like that. Anyway, the bottom line is you feel like having 3D morphing software, and then the 3D morphing software does a surgery. That's what you want, so then, okay, 3D morphing software, if you say that's what it's going to look like, you do the surgery and make it look like that, because it's medicine, it's health, it's body, it's healing, it's tissues, it's scarring, it's all unpredictable really, and we can just try and give you the best idea of what you're going to look like. And hopefully this sort of stuff is rare if you've been counseled properly and had, several consultations before having surgery. Look at people who had similar sort of profiles of implants. The profile is more important than the volume. Something I'll talk about a lot, high profile, low profile, medium profile, teardrop, round, the shape and the profile are really crucial, but also you've got to look at your breast shape you got beforehand and all this sort of stuff. That's why we have our trident approach, where we look at the width of the breast, we look at the breast tissue you've got, and we look at the shape and the profile of implant to try and put it all together to make a decision. But yeah, that's something that we do worry about, and try not to get too much of that sort of stuff happening. But I think people fear it happens a lot, but it doesn't happen very often, to be honest with you. But it's because we try and counsel people really well. Which first, boobs or tummy tuck? Straight to the point there, Sharon, not messing about. Whichever. If you're doing them both at the same time, if you're doing a mummy makeover, I always do the breast first if you're having it in the same day, just because when you do the tummy tuck, you bend the table and it's awkward to do the breast in a bent position. But if you are just having them at different times, I would say whichever is the biggest problem. Because you might have a wound healing problem, you might have a complication, you might not like the anesthetic, and you might not have the other thing. So do the one that you want to have done most first, and then have the other one done, would be my advice. But from a surgical point of view, it doesn't matter. Have whichever one you want done first. It's it's fine to have either one done first. See, what's going on, isn't it? Allergan implants no longer available. I was wondering if you would do live, if you can cover Allergan, as I've seen reports on these being withdrawn due to cancer risks. I have these in and have had capsule contractor, so I'm a little worried now. Yeah, you might have seen this topical in the news about Allergan implants. Have been well, what happens is implant companies have to get a CE mark, which is a mark to say that they're okay to sell in the Europe, and they have to be the CE mark has to be renewed, and they haven't renewed their CE mark. So it's not that they've been actively. Well, anyway, that's what's happened. They haven't renewed their CE mark, so therefore they cannot be sold in the UK or in Europe. And this is related to ALCL, which is a type of cancer associated with breast implants. We always used to say that breast implants can't cause cancer. There is now one called ALCL. It's very, very rare. But it's out there, and it's associated with breast implants. So you need to know about it if you're going to have implants. And they found that there were quite a lot of cases. They thought it was due to the texturing of the implant. Am I them? I don't know, maybe I'm them. We thought it was due to the texturing of the implant. And the reason we think, we didn't thought, we think. And the reason we think that is because there are no cases of ALCL in patients with smooth implants. So smooth implants haven't got any texturing. And so we think it might be something to do with the texturing. And I think there was quite a lot with Allergan, with the texturing, and they thought maybe it's something to do with their texturing. We don't know what causes it, to be honest with you. And the only reason we think that it's due to the texturing is because there's no cases with smooth. There's no sort of causal relationship. So tomorrow there might be a case with smooth, and then we'll think, well, that's gone out the window. So therefore, there's some surgeons are now just putting in smooth implants. We're all telling people about this, but there are no cases with smooth. So if you want a smooth implant, or if you want to have no risk of ALC, well, I can't say there's no risk, because it might, as I say, tomorrow someone might turn up with a ALCL with a smooth implant. But there are no cases with smooth implants. So, but there were quite a lot of cases with Allergan, and they thought it might be associated with this texturing. It is a very rare condition. 1 in 25,000, 1 in 30,000. This is the sort of figures that they're quoted, and it is treatable. It's got something like a 95% cure rate by removing the capsule. It's a cancer of the capsule. It's not breast cancer. It's a cancer of the capsule. It's a lymphoma, and it is treatable. So it is rare, but they haven't renewed their CE mark, so they can't. We can't. I never really used many Allergan implants, but we can't use Allergan. But obviously now people with the Allergan implants think, oh my God, they're terrible. We must get them removed. There's no advice to say you have to remove Allergan implants. So if you've got Allergan implants in, I would say don't worry. You probably are worried, think, God, what's going on? But the advice is, don't worry. If you have a swelling, if you have a lump, and you've got breast implants in, you should see your doctor, whether you've got any Allergan or any. Well, to be honest, even if you haven't got implants in. But anyway, certainly if you've got implants in, that's how ALCL presents. It presents with a swelling or a lump, and it's usually sometime after having implants put in, about 8 years post implants. But as I say, it's a very rare condition. But that is why they have been withdrawn, and that is why people are now moving towards maybe smooth implants. The problem with smooth implants is they've got a higher rate of capsular contracture, and they've got other issues. You can't have teardrop implants because they don't adhere, so they don't so you can't have teardrop. And so, it's another risk, and is the risk of capsular contracture. Therefore, if you have a capsular contracture, you might need more surgery, and there's risk with having more surgery. Is that outweighed by the risk of not getting ALCL, which is such a rare thing? All we can do is tell you what's out there, and we'll give you information on it. But as I say, if you've got Allergan implants in, the advice is you don't have to worry, you don't have to have them removed, you don't have to worry about it. But if you are worried, go and see a surgeon, get checked out. And certainly if you have a lump or a swelling and you've got breast implants in, regardless of what make of implants you've got in, go and see your surgeon to get checked out. But at the same time, please don't panic. To put it in some perspective, the risk of breast cancer is 1 in 8, and it's got not anywhere near like the curable rate of ALCL. So 1 in 8 versus 1 in 25 to 30,000. But you've got a choice whether you have implants. So this is something we tell everyone before they have implants, because you've got a choice whether you have implants or not. If you've already got implants in, I wouldn't be panicked about it, because I think it is a very rare thing, and it's not really something that even the biggest unit in the world, wouldn't see many cases, because 1 in 25, 1 in 30,000. There's about 10 to 15 cases per year worldwide, with about 10 to 15 million people with implants in. So it is a rare thing. But yeah, that's what's happened with Allergan, and it's a bit watch this space really, because that's actually just happened recently. So it hasn't really affected us because we never really used Allergan, but I think it has rocked the industry a bit. Like, ooh, everyone's going towards either smooth implants, or they're going towards what's called nano texturing. So textured implants are quite rough. I looked around as if I had any. I haven't got any here. Textured implants can be, you can have levels of roughness. So some are very textured, very rough. Some are totally smooth, and then there's some ones in between. So some people are moving more towards nano texturing. There might be something there, as a sort of halfway house. And some are so nano textured, some are so not that textured that they're actually classified as smooth, although they are a little bit rough. And whether that's a good thing, I don't know. You know, you could argue there's a problem with the texturing. Nano texturing is better than macro texturing, but surely smooth is better than nano. I don't know whether we should be using nano, whether we should be using textured. Personally, I use textured implants and I use polyurethane foam implants, but I tell everyone about the risks and I say, look, there's no cases of smooth implants. If you want smooth implants, you can have smooth implants, fine. Put some smooth implants in a few weeks ago. That's absolutely fine, but there is a risk of increased risk of capsular contracture. So it's a tricky one. A bit like choosing your surgeon. Nightmare, isn't it? Once you've chosen your surgeon, then they give you all this stuff. Nightmare. How soon after giving birth / breastfeeding can I have surgery? So the couple of problems with giving birth, not problems, but things like giving birth. When you give birth, you're in a hypercoagulable state, you're more risk to get DVTs and things like that, so you don't really want to have a surgery immediately after giving birth. Also, you will have a small child, so you don't really want to be having a surgery, a sort of elective surgery with a baby. So you want to give yourself some time to recover from that. But more specifically, particularly with the breast, is the shape of the breast, the size of your breast. They get bigger when you give birth because the milk comes in, and the longer you breastfeed. So that's why breastfeeding specifically is an issue. So while you're breastfeeding, the breasts stay big, and then when you stop breastfeeding, the breasts go small. And you have to give your breasts time for for the skin to recoil, a bit like your tummy as well. So actually, I was assuming you were talking about breast surgery. You might be talking about tummy surgery. You have to give time for your skin to recoil and for your body to adjust and for your weight to stabilize. So some surgeons would say 6 months, and I would say minimum 6 months. Ideally a year. I would say ideally a year. Plus your baby's a bit older, your your child is maybe a bit more mobile, a bit more easier to look after themselves. So I would say a year after birth, really, but a minimum of 6 months after stopping breastfeeding, really, just to let if it is a breast thing, just to let your breasts settle down, the shape settle. And you'll know yourself if your breast shape is settling. Yeah. That's that one. We've got coming in. Well, they were here already, but does that come up? When can I go abroad following surgery? This one I always say depends on the reason for going abroad. So, and the surgery, I guess. So obviously you've got to recover from the surgery. So you have got to let your body heal, let the wounds heal. You don't, if you've got any little bits that are a bit red or a bit scabby, you don't want to go abroad. So you're looking at maybe 6 weeks to get everything healed, will be a minimum. Then it depends why you're going. If you have to go abroad, even if your wounds haven't healed, you're not going to get stopped getting on the plane, sort of thing. You will be, but it'll be sore, it'll be tender, it'll be swollen. You're not, especially if it's a holiday, you're not going to enjoy it. So I would say give it a couple of months. Even then, you're still going to say the swelling really starts at 3 months. But I'd say, give it a couple of months just to make sure you don't have any problems with infections and swellings and things like that. Because although you say I'm not going to carry anything, it's quite a big deal to go away and go abroad. A couple of months, I would say, would be the minimum. If you really want to enjoy your holiday, I'd say 3 months. You'll probably still be a bit sore. Your scars will probably still be a bit red, so you don't want to get sun on the scars. So that might be something to think of if you're having something on your face. You don't want to get sun on your scars. If you get sun on your scars while they're red, they can stay red. They can get pigmented. You end up with brown scars. So yeah, I would say minimum 2 months, ideally 3 months. But if something happens and you have to go abroad 3 weeks after surgery, you can. But it's just then you ring up and say, oh, it's a bit red and a bit painful. And we'll say, come on, we'll have a look at it. And you're like, well, I'm in Portugal. It just makes life difficult because then we'll get some antibiotics. It's really hard to do that when you're abroad. So yeah, 2 to 3 months is the bottom line answer. Zoe's in here. Jonathan, I gutted. I missed your first 2019 live. Keep fit. Nice to see you back. I am back in the house, Zoe. I missed it last week because I am not fit. Because my back went out and I was lying in bed. So sorry about last week, but I am back and I am well, I'm able to sit for all this period of time, and my back's a lot better. Thank you very much. Got whole physio and all that sort of stuff. I'll do some exercise. Jeez, I don't do anything, you know. So I've got to, you know, I might have to join the gym. God help us. Right. So yeah, I've got some. What other? Oh, I don't know. Have you had enough? I've got some questions here. What's this? These are from Instagram. I've got some questions from Instagram. That's good. Here we go. Sorry. This question says, that worked? No. What are the risks going under the anaesthetic for a breast lift? Okay, so breast lift is quite a big op. It's 2.5 to 3, 2.5, 3 hours. It's not a small one. So it's quite a long anaesthetic. But the beauty of this sort of anaesthetic, and the beauty of, not of this sort of anaesthetic, the beauty of this sort of surgery that we do, cosmetic sort of surgery, it's usually on young, fit individuals. So the risks of anaesthetic are very, very small. So when we talk about the risks of having a breast lift, for instance, we normally talk specifically about the breast lifting, scars and, wounds, problems and nipple sensation and things like that. The anaesthetic risks are definitely there, and there are risks with an anaesthetic, and they are real risks, but they're very small risks, a bit like the ALCL, it's a very, very small risk. People, you say, if you've driven here on the M6, your risk of coming to harm by driving on the M6 is probably more than your risk of having an anaesthetic. So they are small, but there are risks with an anaesthetic. You can, the common, well, not common, the sort of things is things like an anaphylaxis or reaction to the drugs. Now the good thing is you're in a theatre with an anaesthetist and with a hospital, so if you do have a reaction, then we're all here for you. But there are also other risks, like damaging teeth, caps, crowns, and things like that. If they're putting a tube in your throat, they usually use quite a soft tube rather than a proper endotracheal tube. They use a thing called an laryngeal mask, which is a bit softer, a bit kinder on your teeth. But there's sort of risks like with that sort of thing. There's risks with things like inhaling and getting chest infections and what have you. But the risks are usually pretty small. You will always speak to the anaesthetist prior to having surgery. So obviously they're in a better place to talk to you about the risks because they're the expert in that. And sometimes if people have got a real concern, and particularly if you've got other medical problems, as I say, the beauty of cosmetic surgery is it's usually on fit young people whose risks are extremely small of having an anaesthetic. But if you have got other medical problems, and if you are at a higher risk of having problems, we can always get you to talk to the anaesthetist prior to having prior to booking for surgery or whatever. The anaesthetists we work with are really good. They'll give you a ring and have a chat with you to talk about that. So you help you make a judgment on whether surgery is right fit for you or not. And the other thing, you could consider having under local sedation. So you can have a breast lift under local sedation. It's quite a big op to have under local sedation, but it is possible if you have it's usually you are worried about general anaesthetic rather than we're worried about you having the anaesthetic. Usually, most patients are good candidates for a general anaesthetic, but it is something you could consider. And then we've got a last question in the house. Last question in the house here. If you have anything live, by all means, do ask. But the last question I got for you here is this. Oops. Okay. Is this removing a tattoo surgically? That's all it says. That's the question. Removing a tattoo surgically. Not sure the context. Yeah, we do that. We do removing tattoos surgically. I think a lot of people we see didn't realize you could have it removed surgery. For me, it's a no-brainer. I'm like, yeah, you can cut out a bit of skin. Cut out a bit of skin anywhere on the body. And if you've got a tattoo on that bit of skin, you can cut it out, of course. But a lot of people think, oh, I thought I had to have laser. Now, I would say laser is always the first line with tattoo. And if you've got a tattoo, I think laser is the first line, to be honest. I don't think you should have it cut out. I think you should try laser. Because if laser works, it's great. You can't see anything. Problem is laser often struggles, laser can be painful, laser has to be repeated, laser is not good with the color, and sometimes what happens is laser gives you a faded version of the original tattoo, which is actually worse than the original because it just looks like a faded version. So if you have problems with laser, or if laser doesn't work or what have you, you can consider excision. But and basically it means exactly what it says. Is like if you've got a mole in that area, just cut it out. Just cut that bit of skin out. And we often get, and probably the best thing if you have got a tattoo that you're worried about, send us an email. That's what most people do. They send us an email with, or send us a photo rather, and I'll have a look at it, or one of us will have a look at it and say, yeah, that's we can cut that out, or blimey, that's a big one. I don't think we could cut it out in one go. We might need 2 goes or 3 goes, you know, and this is how much it will cost, because when you cut it out first time, you cut it out as much as you can, you leave some behind, you leave it for 3 to 6 months for the skin to soften and relax, and then you can cut another bit out. It's called a serial excision. And sometimes they get really big ones, like massive, get shoulder and all that, and they're like, can't do it, forget it, you know, whole of the back, like, can't do it, you know, sometimes it's not suitable for excision. But certainly small ones in areas of skin elasticity, you know, like in the tummy, and even a big one on the tummy you can remove. You know, it depends on the area and the size. So like quite a big one on the tummy you can remove, but like quite a small one on the finger can be really hard to remove because there's not much spare skin on the finger, and you start cutting it out and you get like a sharp bite, and it's quite moving, hands moving, and the scar can be a problem. So it depends on where it is and how big it is, bottom line. But just send us a photo if you're worried. Rocky start, I would say, but I think we got into it there, and that is that. I'm done. I've done all the questions. Good bit of chatting banter, which stopped because I think you've probably all gone to bed, not unreasonably, and so should I, having said, look at me saying, oh, I don't want to be in theatre all the time. I'm here, 8:31, still here. Anyway, there you go. That was that, and hope that was useful. I am very glad to be back into work and everything in 2019, and I am extremely excited about the prospects in 2019 of the clinic and getting it built up, and you know, giving a good service to people and getting some good surgeons. And I think it's going to be really good. And I know people say, oh, you know, you're not doing any more operating and stuff, but I'm going to be operating with them, and I'm going to be building a clinic and making it something to be really proud of. That's my plan. 2019. For 2019 to 2050 probably. Khan, where have you been? Where you been, Khan? Nice to see you. Thank you for being here. Some buttons aren't working. There you go, Khan. Thanks for being here. I'm going to check out. I'm going to go and do what I need to do my thing. And yeah, next week. Can't wait. Get some questions in. I'm a bit worried I used up all my questions today. I'm not going to have any next week, but please ask me a question. Anything you like. Facebook me, Instagram, or whatever. Jamie Harding, I want you to, if you're still there, I want you to give us a ring tomorrow and book yourself in. Be good to see you, see how you're getting on. I know I'm in Edgbaston rather than Droitwich, but you know, not too far. And oh, Khan's been all night, have you? Oh, you've been quiet. See ya. Sharon Jackson Lomas. Sharon, thanks for asking your questions. For goodness sake, that's my fear. It's my fear of coming on here and I'm sitting like 11 and no one says anything. Thank you for asking questions. I think, God, what haven't I got questions? It's great to have questions. I love it. That is why I say on one of the things which I've got somewhere, please comment and share somewhere. So, don't know where it is. There it is. So yeah, no, definitely. Thanks for asking the questions. And I am going to go and do my rounds, my postdoc rounds, get changed into my clothes and go home and put my feet up. I suggest you do likewise. Not the first bit, just the last bit. Why? Actually, just to put your feet up because you're probably at home already if you've got any sense. And I'll see you next week. Yeah. Live and direct. I'm going to check myself out of here and thank you again. And please ask a question between now and next week. So I've got more questions. So I've got more questions to talk about. Happy 2019. Happy New Year. I can't say Happy New Year on the 15th, can I? But Happy New Year. I should have made that a banner. Anyway, never mind. Do it now. Bye.